series from Sabistion 21st edition. So what we are gonna do, we will read this heading wise. Okay, this heading. Okay, we'll cover heading to heading. Okay, only the important points. Okay. So first is the adrenal, anatomy of adrenal. So the cortex is derived from the mesoderm, and the adrenal medulla is derived from the neural crest. Okay, and the layers of cortex, it's comprised of GFR, that is glomerulosa, fasciculata and reticularis, and it secrete mineralocorticoid from the glomerulosa, glucocorticoid from the fasciculata, and sex steroid from the reticularis. So there is one mnemonic: as deeper you go inside, it is getting more sweeter. Okay. So next, so this medulla is directly innervated by the presynaptic sympathetic fibers. Okay. Then medulla is responsible for secreting catecholamines. Okay. Then adrenal gland is lies within the gerota fascia. This asked many times. Okay. So adrenal is also inside the gerota fascia. Okay. And it has orange yellow appearance. Okay. And the area is usually 3 to 5 centimeter in transverse diameter. Arterial supply is through three sources. Okay. So adrenal, arterial supply of adrenal. So three sources: top, sides and inferiorly. From the top, it is come from inferior phrenic. Okay. From the medial, abdominal aorta and inferior ipsilateral renal artery. So from inferiorly renal, side aorta, from the top inferior phrenic. Okay, remember this inferior phrenic. Okay, and the venous drainage does not mirror the arterial supply. Okay, because it is changed on the right and left. And right side, adrenal vein drain into the vena cava. On the left, it is drained into the left renal vein. So left side on renal vein, right side on adrenal vena cava. Okay. So adrenal glands are anatomically distinct from the kidney. Okay. So right adrenal gland are anteromedial, and the left anteromedial aspect of the liver and duodenum, and the anterior aspect of the portion of adrenal gland. Okay. On the left, pancreas and splenic vein are anterior to cortical surface. Okay. So both side vein are anterior. Okay. And the arrangement is wow: vein, artery and ureter. Okay. So kidney. Okay. Kidney is completely enveloped within the perineal fascia, that is gerota's fascia, and it is mobile structure. Okay. And the gerota's fascia separate the kidney capsule from the parenchyma and adjacent organ. So the kidney capsule is not equals to gerota's fascia. Gerota's fascia is covering the kidney capsule. Okay. So kidney is approximately size of closed fist, measuring 10 to 12 centimeter in length, 5 to 7 centimeter in width, and the right kidney lies slightly more inferiorly because of liver. Okay. And the posteriorly, each kidney is covered by the diaphragm posteriorly on the upper third of its surface. Okay. And the inferior aspect, the kidney adjacent to the psoas muscle medially, and quadratus lumborum and transverse abdominis laterally. Remember, the psoas is medially. Okay. How you can remember? You remember that psoas abscess develop when there is a spinal TB. Okay. So psoas is medially. Okay. Then anterior surface. Okay. Anterior surface on the right side, liver is attached to the kidney through hepatorenal ligament. Okay. Duodenum lies medial aspect of the anterior right kidney. Okay. So duodenum is on medial. Okay. Then hepatic flexor of the colon crosses the anterior to the inferior pole of right kidney. Okay. All these are not that important, but at least you should have one idea. So hepatic flexor on the right colon crosses the anterior to inferior pole of right kidney. Okay. So just you remember, the kidney is a retroperitoneal organ. So most of the abdominal organs should be anteriorly. Okay. On the left side, superior pole of kidneys lies posterior to tail of pancreas. Okay. and splenic vessel and hilum. The spleen is situated anteromedially to the kidney. Okay. The splenic flexure of the colon is draped over the caudal aspect of the anterior left kidney. Okay. Okay. And the renal vasculature has high significant variability occurring in 25 to 40% of the kidney. Okay. Now it's renal artery. So renal artery branches from the aorta inferior to superior mesenteric artery at the level of second lumbar vertebra. So this is important. So renal artery is inferior to superior mesenteric artery at the level of L1. Okay. And renal arteries in arteries. Okay. And that it is superior to renal vein. Okay. Okay. Now come to the renal vein. So renal vein on the right side it is short 2 to 4 centimeter in length. Okay. On the left side it is longer around 6 to 10 centimeter. Okay. So left renal vein is also the common entry point for left adrenal vein, gonadal vein and lumbar vein. This is MCQ. Okay. So gonadal, adrenal and lumbar. Okay. Okay. Now come to anatomy, important points regarding ureter anatomy. So length of ureter is around 22 to 30 centimeter in length. Okay. Okay. And okay. And then ureter has divided into three segments: upper, middle and lower. So upper is from uretropelvic junction to superior margin of the sacrum, the first portion. The middle is bony pelvis and lower is inferior margin of sacrum and continue into the bladder. Okay. So you remember the bony pelvis. Okay. This is the common point. Above the bony pelvis, upper part, bony pelvis is middle part and the lower is from the bony pelvis. Okay. Okay. So there is a three distinct narrowing point in ureter. So first is uretropelvic junction. So connection of ureter from the kidney. Okay. So uretropelvic junction. The second is crossing the iliac vessel and third is uretrovesical junction. So ureter connecting to the bladder. Okay. So this is narrowing point. Okay. So now come to the blood supply of the ureter. So upper ureter has middle vascular supply. Okay. And the lower ureter has lateral vascular supply. So upper one is supply from the aorta. So it is come from the middle. Okay. And the lower ureter is supplied from internal iliac. So it is come from the lateral. Important question asked many times. Okay. Okay. Now come to the pelvis. Is there any important point? Yes. So internal iliac artery. Okay. It is superior and inferior vesical artery. Okay. So that's the bladder supply. The superior and inferior vesical artery comes from the internal iliac artery. Okay. Okay. Then sympathetic innervation. Okay. Through the hypogastric nerve and parasympathetic through the sacral cord and pelvic nerve. Remember. Okay. Para is pelvic. Okay. Sympathetic is from hypogastric. Okay. Okay. In female patient, the parietal peritoneum becomes continuous with the anterior uterus. Okay. Okay. And the bladder base sit adjacent to anterior vaginal wall. Not that important. In male patient, first segment of urethra is surrounded by the prostate. Prostate is surrounded by the lateral pelvic fascia. Yes, this is important. Okay. So three fascia. From the lateral pelvic fascia on its anterior surface, then endopelvic fascia on its lateral surface and denonvillar fascia from the posteriorly. Okay. So remember, the lateral pelvic fascia is on anterior surface. Okay. Lateral is not laterally. And the endopelvic fascia is on lateral. Okay. So that there is two pelvic word. So endo word is on the lateral side and a lateral one is on anterior side. Okay. Okay. And denonvillar fascia is on the posteriorly. Dorsum. Okay. Okay. So rectum sits immediately posterior to the prostate and it's separated through denonvillar fascia. Important MCQ. So the which structure separating prostate from the rectum? It is denonvillar fascia. Okay. 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 Then seminal vesicle. Okay. Seminal vesicle. So it is supplied by inferior vesical artery. Okay. Okay. And this important MCQ, the prostate has got Santorini plexus. Okay, so this is a venous plexus derived from dorsal venous plexus of the penis. Okay, okay, important. Now come to the anatomy of urethra. Urethra has 5 distinct segments: prostatic, membranous, penile, bulbar, and glandular. And the glandular is also known as fossa navicularis. Okay, then prostatic membranous urethra is surrounded by the striated muscle. So remember you this point. Okay. Okay, next. The extra prostatic urethra is through common penile artery. So the extra prostatic urethra is supplied by common penile artery. Okay. Then female urethra length is 4 centimeter, and the proximal urethra is surrounded by smooth and striated muscle. Okay, which form the urinary sphincter. That proximal urethra. Okay. Now come to the anatomy of penis. Okay. So 2 dorsal carpora cavernosa and 1 ventral carpora spongiosa. Okay. So remember 2 is 2C, carpora cavernosa. Okay. And then 1 is spongiosa, single. Okay. And this carpora cavernosa is responsible for penile erection. Okay. And then corpus spongiosum is for urethra, susu. Okay. As for S. Okay. So external pudendal artery supply the penile skin. Okay. And then internal pudendal artery supply the urethra and pair erectile bodies. Okay. Now come to the scrotum. So scrotum is supplied through the external pudendal artery. Okay. And then branch of perineal vessel. Okay. Now come to the few modification. Okay. So remember, internal spermatic fascia. Okay. It form the transversalis fascia. So remember this fascia and fascia, do not confuse. Okay. Then cremastic muscle is derived from the internal oblique. This asked many times. Okay. So cremastic muscle is from internal oblique. Okay. And then external spermatic fascia from external oblique. So this external is external. Okay. Then arterial supply through testicular and gonadal artery. Secondary blood supply of the testicle is through cremastic vessel artery. Okay. Venous drainage of testis initially begin the pampiniform plexus. This form coalesce and form gonadal or testicular vein. Then this on the right side it drain into the vena cava. On the left side it is drained to the left renal vein. Okay. So important. This MCQ important. Okay. So bulbo-spongious muscle surrounding the corpus spongiosa and ischio-cavernous muscle surrounding the carpora cavernosa. Important. Okay. Bulbo-cavernous is for carpora. This spongiosus is spongiosum. Okay. And cavernosus is cavernosum. Okay. No need to mug up. Okay. Now come to the endoscopic urology surgery. Okay. So endoscopic, you have to remember the mainly the size. Okay. So endoscope are size with French. Okay. French FR, and which refers to the outer circumference of the instrument in millimeter. Remember this is outer and circumference. Okay. Outer circumference. Okay. So now you have to remember the some values. So rigid cystoscope size is 16 French, 16 to 26 French. Okay. So rigid cystoscope has larger lumen diameter, greater irrigation flow, improved visualization, and passage of number of working instrument. So everything is got has because of its larger lumen diameter. Okay. Rigid lower track endoscope more difficult to perform in awake patient. Okay. So better tolerated in female because of female has got short and straight urethra. Okay. Then flexible endoscope is of 16 French. So 16 to 26 is rigid and 16 French is flexible. Okay. So then this flexible endoscope you can do under local anesthesia. Okay. Through the lignocaine jelly. Okay. And flexible endoscope does not require any specific patient positioning. Okay. And it is can be used in supine at the bedside. Okay. And because this has large deflection radius, this can like this can go like this. So because of large deflection radius. Okay. Pediatric endoscope has got length of 8 to 12 French. Okay. Just remember 8 to 12 French. Okay. Most common region for either procedure is management of calculus disease. So on which, what is the most common indication for doing urological endoscopy? So calculus disease. Okay. MCQ. Now the semi-rigid endoscope. So semi-rigid endoscope of 6 French to 7.5 French as tip and gradually enlarged to 8 French to 9 French. Okay, so this semi-rigid has got even the lesser than flexible. This is important. Okay, okay. Okay. Then advantage of flexible ureteroscope. Okay, that deflection at the tip ranges from 130 to 250 degree in one direction and 160 to 275 degree in opposite direction. Not that important. Okay. Okay. Rigid nephroscope usually of 25 to 28 French. Okay. You remember this nephroscope. Okay. Okay. So we have finished the anatomy and the endoscopy. The next chapter will read the infection part. The important point, just the important. The important is adrenal. Okay, cortex and adrenal medulla. Okay, then it is the blood supply of the adrenal, important. Okay, okay. Then there is a renal arteries. Okay, end artery and L2. Okay, then 3 segments and 3 narrowing, important point. Okay, this sympathetic is derived from hypogastric and parasympathetic from sacral and pelvic nerve. Okay, and this denonvillar fascias, important. Okay, okay. Then sentorni plexus, important. Okay, then the segments of the male urethra, important. Okay, okay. Then this penile anatomy is important. Okay, the venous drainage of the testis is important. Endoscope, the size, and thus this word is very important, outer circumference. Okay, in millimeter. Okay, okay. Thank you.